Thank you for all of your wonderful engagement. Yes, ma'am. Is this a thing? Hold on. We have presents. Yes, Academy Health D&I. You want me to announce it? Yeah, sure, absolutely.
Okay, well, we'd love for a designated person from each group to just share your thoughts with everyone else. All
right,
your responses.
Yeah, let's come together. Shh. Does one of our groups on your left, my right, do you guys want to share? Shh.
Come back.
So what we were trying to do, like as a thought experiment, was to say, like we are thinking pre-conflict context, right? What about taking Ireland as an example? And we had an expert on Ireland, on the context of Ireland. We were thinking, okay, what contribution could implementation science, after it took us 10 minutes to have a joint understanding of what implementation science does, and really you guys make it complicated for us, but but then we were thinking, okay, what could it contribute to a context where there might be social unrest in the future, and what could we compare now? And like we were looking into xenophobia, we were thinking in the direction of xenophobia. We were thinking in the direction of identifying let's say the sweet spots in the systems that could still function when shit hits the fence and social unrest escalates. So we were thinking in many different directions. We were not always 100% sure whether this is still implementation science, but this was basically where we are getting it.
I think at least from the framework of the EPIS framework, which looks at contextual factors affecting implementation science, those are definitely relevant. Thinking about the risk factors that might precede conflict, but then also the areas of the system that contribute to resilience. Yeah, great.
Thank you so much. Let's go to this side of the room.
So this is a big question. I think that was get the consensus here, and so we started thinking about breaking this question down. Because it's about preventing conflict, and so we talked a lot about some of this conflict being driven maybe by a handful of leaders, right, up at the top. And so what are some of the strategies, implementation science strategies that we have Greg Aarons here, so his leadership work is one way we can leverage to think about how to address these issues at the leadership level. Another thing that also came up in our discussion centers around some of these conflicts are also driven by militaries, right? So armies, and we talked about the idea of PTSD being a very big risk factor as a national security issue in some of these armies. And so if you can get down to that level using implementation science strategies to sort of address that, and we had good examples here, our colleague from Holland, the Netherlands, who they are doing this with their army, with the police, and all of that to address some of this PTSD trauma in the armed forces. So that might be a way to do that. And our colleagues from GDI also have some really, really relevant examples about using addressing actually violence, personal violence. I think in Liberia you said, in Liberia, working with young men, addressing some of these issues to basically young men who may be more likely to commit violence 10 years from now, addressing these issues to prevent those before they actually happen.
Those are really great suggestions all around. I think addressing mental health crises would go a long way in the prevention. Do we have any more groups on that side? No, I think that's everybody, right? All right, we've got some folks over here. Who wants to share out? Everybody's looking at everybody else? Okay.
Okay, I will endeavour. So we had quite a politically reflective conversation. And I think some of the strands that came out of it were a reflection on, is the best use of implementation. It was that we have a sense that we do know what best practices are and we do know what should be done, both in advance of crises happening, you know, in response phase and the kind of development and protracted or kind of aftermath. But what are the gaps in terms of why that isn't happening, especially when so many actors across implementers, researchers, funders often kind of know what should be done. So we were reflecting on what we've heard and where implementation science can really study the barriers, the processes, some of which we've heard about the collaborations, you know, from the outset with governments, you know, with funders, with the local communities, or relevant communities. I think that's the gist. Huh?
Well, and the barriers in the funding structures specifically. I mean, we often look specifically at our work, but taking a look at, we've been talking about the, like from Beats's presentation on these structural components, and really building an evidence base around the structural components that are continuing these systems of violence.
Yeah, we also talked about how lessons and structures from past crises have helped. And the preparedness, like in terms of COVID, that helped some countries not enter into the crisis that, you know, from Ebola, helped several African countries not go into the same level of crisis in Western countries during the COVID pandemic, right? So if we leverage on those systems, that preparedness, what are we recording? What are we capturing, even in the times of peace, right? How do we leverage on this to go forward? And I was also, I think we talked about the fact that part of when you look at what nonprofits do in terms of monitoring and evaluation, right? They're looking at their inputs, their processes, their impact outcomes, right? And sometimes you're measuring efficacy outcomes and all of that. What about the processes? What did you do to get there? And that's what we want to capture here and measure and analyze, right? What's going on there. And if we have that frame of mind in the work that we're doing, I think it helps us to integrate implementation science practices easier.
Oh yeah, we shared the example from San Diego being a border town and a refugee resettlement hub. The refugee communities can be very diverse, and in areas of displacement also we see that quite often, where there are different encampments and different groups that are very diverse. How do you deal with community voices that might be different, community needs that might be different? So in San Diego, the refugee communities all came together and organized and created something called the Refugee Community Coalition, which I think is a great model of also kind of honoring the voices of diverse groups. But also this group sole purpose is to really be ready for implementation of different programs, and it takes time to build trust between academics sometimes and communities, as we know, and humanitarians and the different players again. So kind of investing in trust building, but that could be a model possibly that could be replicated globally.
Great, thank you. Was there a mini cluster over there? Were you guys part of the same group? Detected.
A lot of the things that we discussed have already been shared, so I won't take too long, but we also discussed funding structures and kind of talked about implementation science and the potential it has to, I guess, move the needle ideally in the minds of funders towards the need for, you know, circling, not just creating this knowledge and it lives around up here, but that it gets applied. We were also talking about when you are funded by someone who does not value the implementation science piece, like what things can you still do, and like when you cut back, what are the best ways to cut back, and like, does that mean you only do things at the end, or are there still little things you can do along the way? We had a conversation about that. And then we also had an interesting point brought up about the kind of interdisciplinary relationship to implementation science, and like how's it viewed in sociology and psychology, like in other disciplines, and is it something that could be like a unifying type of interdisciplinary initiative, and how can we build that up? Oh, go ahead.
No, thanks. It was a great summary. Just two additional points. We were also discussing, sparked by Anne's question about humanitarian context, what is good enough implementation science approaches? Obviously, the gold standard is working from the design stage in getting everybody around the table. What can we realistically do with post facto evaluations or research for interventions that have already occurred, and we're looking to at least glean some learnings from that? Can that even be attempted? And that's a really open question. And the second is just a question about causality in very complex social interventions, where the outcomes or impacts may, especially in context of forced displacement, have so many other confounding variables. How can we really show that causal relationship in a way that is digestible to the evidence end users we're trying to influence? Thank you.
Some really great responses, and thank you everybody for all of your active participation in these breakout sessions. It's really great to see. I have two shameless plugs, one by request, to mention that there is an annual conference on implementation science. There's more than one, but a big one is the Academy Health Dissemination and Implementation Conference, which is held in December. Academy Health, it's a really great conference. I got to go last year for the first time. Definitely hang out with Teresa because she knows everybody. She's like, great energy. But yeah, it's a great opportunity to meet obviously amazing people in this field, and to like learn how we can take the lessons that we've learned from this kind of event and start disseminating it out. Which brings me to my second shameless plug. I don't know about you, but I've been really inspired by this event. And I think a really crucial next step is taking everything that we've talked about and turning it into some action steps. And I think others have interest in this as well. So there's some discussions of maybe publishing on, maybe setting an agenda for this area. It would be really wonderful to have your brilliant minds participate. So if you are interested in that, send us a note, figure out how to co-create this important document to share with others. So that is all. Thank you.
Hi, okay, I'm gonna introduce myself. I haven't been up yet, but I'm Libby. I've been the one running the mic around. Thank you, oh, thank you. I'm the Mutual Learning Manager at the RPCA, working really closely with Teresa.
And I'm the Administrative Manager, also working very closely with Teresa, and I'm also another Rachel.
And I'm Jameson. I'm the administrative assistant, also working really closely with Teresa and the rest of this team.
And we just wanted to take a moment, to thank all of you for your flexibility as we've had to move things around, with the constant emailing, to all the panelists, moderators, facilitators, for helping workshop the content of it. Having your feedback and integration, I think, really made this event what it was.
Yeah. And we also wanted to say the biggest thank you to Dr. Rachel Hoare. Without her, we would not be in this space without her. We had Saturday, very jet-lagged phone calls with her for a couple of hours, but she's just absolutely amazing. And we wanted to show our appreciation from Boston with a little gift. And we're just so appreciative.
Gift, and I didn't have any time to go anywhere. I was thinking I need to go to a cheesy Irish shop and get them something. So it's really you I should be getting the gifts for, and thank you so much. And it was great crack at the weekend, wasn't it? Yeah. Thank you so much.
Perfect. So with that, we'll turn it back over to Rachel.
Oh, thank you.
One more. Oh, yes, of course.
Since everyone's doing shameless plugs, I just thought I would grab the mic as well. But I'm actually an associate editor at the journal Conflict in Health, which is highly relevant for this conference. And we've been talking a lot about social and structural determinants of health in these last 2 days, and we actually have a special issue on the social determinants of mental health. So we'd love to hear submissions or get submissions from any of you on any research that you are currently doing. I'm not even sure what the end date for submissions are. I think we're pretty flexible. It tends to be kind of a long, ongoing thing, and it just needs to be a conflict-related setting and something related to social determinants of mental health. So, yeah, thanks. And there's fee waivers available for those from low and middle income countries. Conflict and health. I should have gotten a QR code organized for you, but if you Google conflict and health special issue, it'll be there.
Make one myself, but I think I've done enough. So I think I'm going to introduce you now for some kind of summing up comments from Professor Paul Wise, who I think has probably got the hardest job of the whole 2 days because he's had to listen very carefully to everything everyone's saying. I'm delighted to welcome him. I am going to read out his bio because I know you want to hear a final bio, but I think it's really important that we do this at the end because I'm sure you're sick of reading as well. So Paul is a professor and senior fellow at Stanford University. He is a professor of child health and society, professor of pediatrics and health policy, and senior fellow at the Freeman Spogli Institute for International Studies in Stanford. Dr. Wise's work bridges the fields of child health inequity, public policy, and international security studies. Since July 2019, Dr. Wise has served as the juvenile care monitor for the U.S. federal court, overseeing the treatment of migrant children in U.S. detention, and we had a really good conversation about this earlier. Since February 2022, Dr. Wise has also served as a senior advisor to the Safer Ukraine initiative, which to date has evacuated some 1,400 children with cancer from Ukraine. He's published widely, and his contributions, interdisciplinary contributions, have been recognized by election to the American Academy of Arts and Sciences. So it's a great pleasure that I welcome Paul to give us some final remarks and comments.
Well, thank you so much. I appreciate the invitation to participate in this important meeting the last few days, and also the opportunity to convey some comments, not a summary. Nobody could do that. I'm also very aware that I'm the only thing standing between you and a glass of wine or a pint of Guinness, so I'm going to make my comments brief. I think the first thing I'd like to recognize is that that you people in this room with your colleagues around the world are always the ultimate inheritors of a failed social order. That sooner or later, the breaking of community bonds, the destruction of traditional protections for children and families will ultimately wind up in your clinics, in your wards, and unfortunately, in the morgue. That gives you a special opportunity, as well as, I feel, a responsibility to address the well-being of kids, the mental health, particularly of children, in conflict, in complicated security, political settings. So how best to navigate that responsibility? Well, the first thing I think is important to mention is how deeply I respect your technical approaches, your capabilities to bring coherence to what the policy world always sees as arena of uniform complexity. It's important because generally in the policy world, particularly in the global policy world, mental health services have been traditionally viewed as not being particularly effective. And when people do not believe that your arena of service has efficacy, there is no way you can advocate for enhanced access to it. If people don't believe it does anything, how are you going to advocate for enhanced access to it, the resources that are required? So the technical conversations, the approaches, the implementation science that you've been discussing for the last couple of days and have been doing around the world is critically important because it has the potential to strengthen the belief in the efficacy and effectiveness of the services that are so critical to the mental health of children in some of these areas of the world. The complexity can be undermining. That I was smiling when you were presenting first day the different diagrams with the boxes and the interactive arrows. Most policy makers do not see mental health that way. They see it as fettuccine. It's just too complicated. And bringing coherence to the conversation and empirical insight into what works, what doesn't work, is critically important to the broader advocacy for the provision of not only mental health services, but all services for children and families in these complicated security environments. I was also, have been very impressed with the respect you show to deep collaboration, that built into the science is a recognition of how important and how difficult it can be to create collaborations across different disciplines, and particularly with the local communities that have have been victimized, but also have the great strengths that are going to be required to implement these kinds of programs. And the academic implications, something that I deal with a lot in the academic world, is you have to realize that the rewards in virtually all academic settings are based on gaining deep expertise in a sliver of one particular discipline. That's how you get tenure, that's how you get your degrees, that's how you get known. In fact, in medical schools, people build their whole careers investigating one half of one enzyme. But the problems that we're facing here over the last few days defy simple, highly focused disciplinary endeavor. It requires clear transdisciplinary initiative and enterprise. That does not happen by itself, and we have world experts in understanding how best to go about doing it. It has to be brokered. It has to be curated. It has to be translated in ways that often, if not met with complacency in the academic world, it can often be met with frank resistance. The other issue is the deep collaboration with the local communities. Not only is it the best guarantee that your research will be good and ultimately pragmatically useful, but as has been mentioned, it is also critical to questions of social justice. And this being built into your approach, I think is very important to recognize, maybe not unique, but it's special. And don't take it for granted, because when you talk within yourselves, it almost goes without saying that this is important. It must go with saying. And I'm here as a somewhat outside observer just to recognize and respect that. Altogether, this demands an infrastructure of funded global collaboration to build the kind of consortia that recognize the importance of these collaborations and learning from different parts of the world and different experiences. We do not have that type of support, that infrastructure for collaborative learning around the world. It is something that should be demanded and something that is guided into existence. Okay, I've talked about the importance when a social order fails. I've talked about the importance of your analytic approaches. I'm also going to mention a few challenges. The issue of the nexus between peacebuilding, humanitarian interventions, and development is important, no doubt. But I think it is worthy of more, I would say, detailed or purposeful investigation, particularly using the techniques and skills that you have developed. Why? Because the taxonomies of violence around the world are diverse, and they're also dynamic. When I hear things like Build Back Better, I get a little nervous because most of the children living in conflict areas around the world live in places of protracted violence, of crescendo and decrescendo, and crescendo again of violence over protracted periods of time. How do you build back better the Eastern Congo, Tigray, parts of Ethiopia, parts of northern Nigeria? I work a lot in Central America, Venezuela. You have areas of protracted, churning violence and of different kinds of violence. Some, particularly where you have the state is one of the combatants, that make the nexus complicated, at least. How do you do development, which almost always requires trying to build state capacity, engaging with the government? How do you do that when the government is a combatant of part of the conflict itself? Humanitarians have 4 principles, basic principles: humanity, relieve suffering, save lives; impartiality, we provide services based on need, not based on affiliation. But they also have neutrality and independence. In many areas, the only way to get to some of the neediest populations is to engage with armed non-state actors that control those populations, which of course the state does not want you to do. And the requirements of development can conflict with the requirements of humanitarian action. And this is particularly true because humanitarian norms that should be providing protection for humanitarian development and peacebuilding activities are eroding in most of the world. And this creates important challenges in making this nexus real. You have the capability to map these areas of opportunity and obstacles in ways that other people, other disciplines have not, and help create some solutions. And there are some solutions. What I do for a living is look at how services can be provided in many of these areas. And almost always, local protection is the critical thing. And that is because if it's a publicly valued commodity or service, healthcare, mental health services, a specific program that you've developed is viewed as a public good, it is a currency in the struggle for legitimacy in the political sphere. In other words, if people value this and it's being delivered by a state program, many armed non-state actors are going to attack it because it's a battle for legitimacy. And if they see something good being provided by the state, it is vulnerable to attack. Similarly, you get other currencies that are at stake. This is why in some places, health centers, hospitals are attacked viciously. Absolutely no protection. Other places, it appears miraculously they are protected. It's because the calculation politically by the combatant groups recognize they have more to lose by attacking your program, that health facility, than the benefits they gain by an attack. And almost always that is understood clearly by local actors, local protectors. And the best way to ensure that your programs and services are protected is to build the deep collaborations that you've been discussing for the last 2 days. It also speaks to questions of sustainment. How do you sustain something in an environment of churning violence, of crescendo, decrescendo? The local engagement will give you the best guarantee that whatever you're doing and the skills that are conveyed and the relationships that are built are in fact protected. My last observation speaks to how inspirational your work is, particularly to somebody like me who is not smack in the middle of this kind of work. It's something to celebrate, and I think it's important as you leave here for your glass of wine and your pint of Guinness to recognize how important that is, how inspiring your work really is. First is, again, this deep respect for deep collaboration. That is unusual. People mouth it all the time in global health. They don't do it. You, almost by definition, are attempting to do it and have been successful in many of the cases that have been presented. It's a guarantee not only that your research is going to be more effective, but it also speaks to questions of justice, which is also important to you. One caution, that recognizing that injustice is a determinant of health is different than making justice a goal of your enterprise. There are different sets of responsibilities than looking at social justice and injustice as a determinant in a causal pathway than it is building services that indeed have social justice as a goal. And that is because almost always in our meetings, our technical meetings, it's about discovery, innovation, experimentation, p-values. But what is needed by making justice a goal is collective action, what I would call solidarity. And solidarity is never discovered. It is created. And it takes special requirements and special actions, special collaborations to make that a reality. I'll end with just an image of how I see your work and why I think it's so important. The technical research that most people do in the field of global health, it's basically like a group of researchers writing down the movements of a troupe of dancers, but from behind a plate glass window. They can record with great fidelity every turn, every leap, every jump, but they never hear the music. Your work, unlike most arenas of global health research, has the capability for you to hear the music, and indeed, being here the last couple of days, I would suggest that you do hear the music. And this fugue of interaction that you hear provides ultimately the substrate, not only for healing, but I would suggest also for the struggle for social justice. So thank you.
Thank you so much, Paul. We've decided not to have a Q&A now because we feel you're probably all just jaded and want to get out, but Paul will be available. If you want to go and chat to him now and have questions for him, I think we decided to do it like that. So thank you so much for coming and for staying to the very end of the two-day symposium. It's been an absolute pleasure to meet all of you, and I hope you've enjoyed it and have a fantastic rest of your time in Dublin or Europe for some of you, and it's been great. Thank you so much.